Awesome. Well, thank you so much, everybody, for joining and taking time out of your lunch to be here today. Want to just say today's World Oral Health Day, a day dedicated to highlighting the vital connection between oral health and overall well-being. Something that's kind of not as remembered as often, but as we embrace the theme, as the World Health Organization puts it, a happy mouth is a happy mind. We are reminded that the oral health is not only a key indicator of physical health, but also impacts emotional, mental, and social well-being. Um, but please join me in welcoming Dr. Donald Chi, a nationally recognized expert in pediatric dentistry and dental public health, to share his insights on the science, benefits, and safety of fluoride. Before we get started, I just want to let you know that this session is going to be recorded. And if you have any questions, please feel free to use the chat or Q&A function to ask any questions, and perhaps we'll have some time at the end to answer a couple. But without further ado, Donald, please take it away.
Wonderful, great. Thanks, Sebastian. And yes, I wanted to reiterate, happy World Oral Health Day. March 20th is the day that we celebrate oral health and recognize how important oral health is, not just for in and of itself, but given all the connections between the mouth and other parts of the body. It's a great data to recognize the importance of that. So today, I'm going to talk to you about everything you ever wanted to know about fluoride and maybe then some more for you and your loved ones. And really, what this is aimed at is helping you to know what you need to know to decide whether fluoride and the different sources of fluoride that are available, whether they're right for you. And so this is not meant to be a prescriptive conversation. This is not clinical advice. I'm not your dentist, and so really I'm here to provide you with the best available evidence that we have, so that you can make the best decisions for yourself when it comes to fluoride. I have no conflicts of interest, but I do have a disclosure. So as I mentioned, and as Sebastian mentioned, I am a pediatric dentist. I continue providing care a day a week. So I am a professor at the university. I provide dental care at the Odessa Brown Children's Clinic down in Othello. I'm also a scientist, which gives me, a positionality in terms of understanding the science and publications around fluoride. Fluoride has been in the news a lot. And I think that it's really sometimes dizzying to keep track of all the different things that come flying at us, from the media when it comes to fluoride. And I'm also a parent, so I have a 6-year-old daughter and a 15-month-old son who you might be able to hear in the background. He's eating lunch now. And actually, in this photo, he's eating. He's constantly eating, so really, notwithstanding my professional hats that I wear, as a parent, I know that we are barraged with all the different decisions that parents are asked to make in regards to both promoting and protecting the health of their children. So that I really do want to underscore that sometimes it can be overwhelming. There's a lot of information out there. There is a lot of misinformation out there, and I think there's a lot of inaccurate information out there. And what I want to do today is boil it down and really make it easy for you to determine, again, whether the different sources of fluoride out there, whether they're right for you and your kids. So three objectives. I'm going to describe the three main sources of fluoride that we have here in the U.S. I'm going to talk a little bit about my research that explains why it is parents in particular have become hesitant about fluoride. And this is a hot off the press research. We've been doing this work for the last 5 years with the help of an NIH grant. And so we're starting to understand the mechanisms of how it is that parents become hesitant. And then, as promised at the beginning, I'm going to outline the information you need to make fluoride decisions. So really, it all started with water fluoridation. Before the early 1900s, we didn't really know much about fluoride. A dentist by the name of McKay noticed that individuals living in certain parts of Colorado presented with what was called Colorado brown stain. And what it was a mottled enamel, and the teeth tended to come, really dark brown, light brown. And what they also found, what McKay and his colleagues also found, is that individuals with this brown stain also had significantly fewer cavities. Now, fast forward 30 or 40 years, what this mottled enamel subsequently became known as is fluorosis. And the cause of this modeling was found to be fluoride. So there were naturally high fluoridation areas in Colorado at the time, and that was what was identified as the source for this modeling, but also for the protection. And so, after a lot of scientific studies, the ideal amount of fluoride needed in water to reduce fluorosis or minimize fluorosis, but also to get the preventive benefits from fluoride was determined. And that's really when we started fluoridating water. It was in the 1950s. So communities started fluoridating water. And ever since then, we found that, that communities that get water fluoridation, individuals in those communities have less cavities. Now, the reverse is also true. What we've also found is that when fluoride is removed from water, cavities increase. And we've seen that in communities, including Juneau and other communities here in the lower 48. One of the great things about water fluoridation, as you may all know, is that it eliminates inequities in access to fluoride. As long as you have access to a tap that provides community water, it gives access to fluoride to everyone. It's really, I think, important to underscore how important water fluoridation has been in the U.S. and around the world in terms of reducing cavity rates. Cavities are the number one most common disease, period, in children, adults, the U.S. and almost every country out there, and for that reason, water fluoridation has been deemed one of the 10 greatest public health achievements, up there with like seat belts and other things that public healthers really have grown to value as model public health achievements. So you can find fluoride in other places too. So based on this original identification of fluoride in water in Colorado, we also, as a profession, as a field, found that, okay, well, maybe there's a way that fluoride can be incorporated into things like toothpaste and oral hygiene products. So here's just a snapshot of images of different kinds of toothpaste that are available in different flavors, all of which contain fluoride. Now, you do have to look at the label to make sure that your toothpaste does have fluoride in it. All toothpaste that are over the counter in the US have the same amount of fluoride in the US. So whether it's a children's fluoride toothpaste or an adult fluoride toothpaste, if it's over the counter, the amount of fluoride is the same. Now, the flavorings can be a little different, of course. And the third main source of fluoride in the US is what I'm calling topical fluoride. So this is the type of fluoride that you would get when you go to the dentist. So you go to the dentist every 6 months or every 12 months, and fluoride can come in different formats in terms of the type of fluoride that dentists provide. So some dentists may continue to provide fluoride in trays that you keep on your teeth for 3 or 4 minutes. It can come in the form of either gels or foam. What's more common these days is what we call fluoride varnish. It's a sticky substance. In the olden days, it used to be really dark brown and didn't taste so good. And now there are clear or translucent fluoride varnishes that actually taste pretty good, that are painted on with a brush, and then you're ready to go immediately after, so you don't have to sit there and wait for 4 minutes with big trays in your mouth. We know that fluoride varnishes, so the fluoride that dentists and physicians and nurses provide in healthcare settings, that it prevents cavities, both in permanent teeth and in primary teeth. So we know that fluoride varnishes work. So much so that the U.S. Preventive Services Task Force has a couple of recommendations regarding fluoride for young children. So for children under the age of 6, fluoride varnish is recommended if the child is at high risk. And then there's also the recommendation here that I have marked with a red box, that children living in areas without water fluoridation, that they receive oral fluoride supplementation. And what this means is it's prescription fluoride. So this can come in the form of tablets or drops that are put into water. So we know that fluoride works, and again, we know that the U.S. Preventive Services Task Force, they have very, very stringent criteria for recommending preventive treatments. And if the evidence isn't there, they don't recommend it. So we know that, all of this, and yet when you go online, when you open up newspapers or open up web pages and see a story about fluoride, there's a lot out there about the negative effects of fluoride. We see that here in Washington, where communities oftentimes will very fiercely debate about the need to either continue fluoridating water or maybe to start water fluoridation or to end it, depending on what your community's water fluoridation status is. So just a couple of snapshots from a couple of years ago in regards to the debate regarding water fluoridation in Spokane. We know that Port Angeles and Clallam County has had some recent controversies over, again, a community level controversy over the decision to continue fluoridating. And there are many, many other communities, both locally and around the country, that have come to this community level concern about fluoride. Lots of other websites here, aside from the concerns about water fluoridation, that indicate or highlight studies showing links between fluoride and pretty much every condition, disease, or ailment out there. So whether it's thyroid disease, autism, low IQ, developmental defects, fill in the blank, you can probably find a website out there indicating some kind of study linking the two. There also are websites out there indicating that, again, that fluoride treatment that you get at the dentist is unsafe. So fluoride is a poisonous substance with common side effects, and that young children have died as a result of getting too much fluoride. More recently, there have been studies indicating links between fluoride exposure during pregnancy and low IQ in young children. And a lot of the stuff out there is published in fringe journals, meaning low quality journals. This is an example of a published study in a very highly regarded journal in the Journal of the American Medical Association. So we're starting to see publications in high impact journals, which again elevates the level of concern that parents like me, parents like you, might have about fluoride. And then most recently, the next National Toxicology Program in August released a monograph indicating concerns linking fluoride exposure and neurodevelopmental outcomes in children. So aside from what you might see online, aside from the things that we see in the media and in the scientific literature, I think that, I do want to talk about three concerns about fluoride. I think that are legitimate and also kind of unpack some of that. So I think that when it comes to water fluoridation in particular, community members might talk about the importance of autonomy, meaning an individual's choice to consent to whether or not an individual should be exposed to water fluoridation. Totally understand, it makes sense. And I think that it's an important consideration when we think about interventions like water fluoridation that a whole community would be exposed to. Now, I think it's also really important, as I mentioned at the start, in terms of one of the benefits of water fluoridation is that it reduces inequities in access to fluoride. The flip side of all of this, or the flip side to autonomy, is the issue of health equity. And I think given how important oral health is, and knowing that low-income populations, minoritized communities have difficult getting to the dentist. They may have barriers to getting fluoride toothpaste in their homes. There might be other barriers to regular toothbrushing. I think it's important to keep in mind that water fluoridation, because it does remove barriers in terms of access to fluoride, that there's a health equity issue that I think comes up against this issue of autonomy. And I think this really is the core of the debate when it comes to water fluoridation is this inherent tension between autonomy and health equity. So I don't think it's as easy as just saying, you know what, it's my choice. I don't want fluoride in the water, and then to ignore the issues of health equity. The second issue is fluorosis. So we mentioned Colorado brown stain. Now, when you look at the teeth that McKay observed in the early 1900s, this is probably what he saw. I mean, these are brown stains. So you can see here, these are magnified teeth, but the teeth don't have to be magnified to be able to notice the modeling here and the fluorosis. This is pretty intense fluorosis. Now, the type of fluorosis that we see in the U.S., this type of fluorosis you would not see from drinking fluoridated water in the US. These are typically cases where an individual has lived in another country and has moved to the US, and we'll see this. And I see this quite a bit in clinic from patients who have spent time or lived in parts of Africa, different parts of Asia, where the fluoride in the water is at very, very high levels, and you would have this type of brown stain fluorosis. Now, typically, the type of fluorosis that we would see in clinic that is more common for individuals who have lived in the U.S. their whole lives is this type of fluorosis. So it's kind of a whitish, spray painty type of fluorosis you can see here on the corners of these front permanent teeth. And this type of fluorosis actually isn't from water fluoridation, and it's not from topical fluoride that you would get from the dentist. What this is from toothpaste. So a child who's given kind of free rein with that tube of toothpaste and chronically has consumed and swallowed amounts of fluoride over time that aren't toxic, but that can lead to this type of fluorosis. This is what we would typically see in clinic. And this really underscores a point that I'll reiterate later is the importance of supervision. Fluoride is a medicine, just like everything else. And I think this idea, because we can get it over the counter, that kids in particular should be given free rein over fluoride is a misconception. Fluoride is a medicine. And so the type of fluorosis that we would see in the US, a lot of this can be prevented with some parental intervention. And then the issue of fluoride-related deaths, and I think that this is something, I teach first-year dental students public health, and this is something that we talk about in public health, is that, you might have a patient coming in and saying, hey, well, I heard someone drank fluoridated water and died, or I heard someone got fluoride from the dentist's office and died. And in fact, both of these instances would be true. There was an incident in Hooper Bay, Alaska in the early 90s where because of the lack of supervision during a very brief time period, a whole bunch of fluoride was added to the water. One adult got sick and died, and dozens got sick. This was actually written up in the New England Journal of Medicine. And this incident, unfortunate as it was, what it really catalyzed was the importance of making sure that water operators had the training needed to oversee water fluoridation, and then to also make sure that the monitoring process is in place, that communities have proper monitoring of water fluoridation. And before this time, there was regulation; it just wasn't super strict. And so now there are standards in terms of what communities need to have in place to prevent accidents like the Hooper Bay incident. So the significance of all of this, we have both a domestic, local, and global tooth decay epidemic. Fluoride is one of the few, if not the only, evidence-based preventive strategy we have available to us in dentistry. There really is nothing that reaches the level of evidence in terms of being able to prevent cavities. So fluoride is one of the few strategies we have available. And I think it's important to keep in mind when it comes to fluoride related decisions, we have both personal decisions we can make and we have public health level decisions that we can make. And I think this will become a little clear as we talk a little bit more about fluoride hesitancy. Water fluoridation is generally a community level decision that we make, although individuals can also make individual or family or household level decisions to pull the fluoride out of the water with different filters that are available. And then we have toothpaste and topical fluoride. So these are the main sources of fluoride is fluoride in your water, toothpaste, and topical fluoride. So topical fluoride hesitancy and refusal. So when I first started practicing after I finished residency and moved back to Seattle in 2009, I started seeing a pretty significant number of parents who would come in and say, you know what, I don't want fluoride for my kids. And this was about 15 years ago. I didn't know what was causing that. So I went to the literature, I went to databases to try to figure out, okay, what is going on here? And there wasn't a whole lot available at that time. And so that's when my scientific interest in the topic started. And that coincided, I think, with the growth of this challenge in clinical settings where parents would come in and be concerned about fluoride. So really when I think about topical fluoride hesitancy and refusal, it's a spectrum behavior where at the one end of the spectrum you have total acceptance. You have some parents who come in and say, you know what, I don't need the fluoride spiel, put it on my kids, I got to get them back to school. So parents who are not concerned at all, they totally accept it. All the way to the other end of the spectrum, where you have total refusal, where you have a parent or a household who might say, you know what, I don't want any fluoride. I don't want the fluoride that you've asked if you can apply to my kids' teeth during the checkup. Today, I don't want fluoride in my water. I don't want fluoridated toothpaste, nothing. So no fluoride. And then somewhere in between, we have varying degrees of what we call fluoride hesitancy. That you might have parents who, might have, some minor concerns, but generally they're fine with it. So they may not bring it up in clinic, all the way to, parents who may not refuse all sources of fluoride, but they may pick and choose. They may say, you know what, I don't want topical fluoride from the dentist, and I don't want water fluoride, but maybe the toothpaste that has fluoride in it is okay. So you have some kind of combination of hesitancy. And how common is it? So back in 2009, after I started seeing this in clinic, we did a study in 3 clinics in the Seattle area to look at the prevalence of topical fluoride refusal. So this is the type of refusal where a parent would say, I don't want any fluoride for my child. And we had 3 clinics. We had a community clinic, private practice clinic, and the UW Center for Pediatric Dentistry. And what we found is that across the 3 sites, fluoride refusal prevalence was about 5%. So about 5% of parents were coming in and saying, no, I don't want fluoride for my kids. Now, subsequently, we did get a grant to understand and study fluoride hesitancy. And what we found is hesitancy, again, can be a spectrum behavior. You can have really low hesitancy and you can have really high hesitancy. But looking at the most recent data, which I'm not going to present today, but what we found is that 80% of parents had some degree of hesitancy when it comes to fluoride. So again, so it could be very, very small, it could be really extreme. So we can see here, while topical fluoride refusal prevalence is relatively low, hesitancy is much higher. What we did was we also surveyed dentists to get an idea in clinic. Are dentists seeing fluoride hesitancy to be a problem, fluoride refusal to be a problem? So we did a survey. This was probably about 6 or 7 years ago now, maybe a little longer than that, 7 or 8 years ago, surveying dentists. And 80% of the surveyed dentists believed that fluoride refusal was a problem in clinic. And over 40% believed it to be a growing problem. So this really was consistent with some of the observations I had been making in clinic. And we also asked dentists about what are some of the parent characteristics in terms of perceptions that might be related to a parent who refuses fluoride. And there were 3 in particular that dentists noted. So parents who refuse vaccines, white parents, and then higher income parents. So this gives us an idea of a general sense of the type of parent that might come in and say no to fluoride. And as a dentist, this is really important to know so that we can make sure that we can have communications around fluoride that don't offend or get people upset, because fluoride related decisions can be very personal. And as a pediatric dentist, again, we're talking about the health and well-being of our children. And so this is why discussions around fluoride can get really emotional and difficult. So it's really important as a dentist for me to know, okay, who's more likely to come in and say no to fluoride so that I can be ready to have these conversations. So why is it that parents are hesitant? So now we know there's a a growing number of parents out there who are hesitant about fluoride. So why is it? And this why is really important because again, it really comes down to trying to improve patient-provider communications, not necessarily to convince a parent or family to say yes to fluoride, but to just make sure that as a dentist, as a provider, we are in a position where we've given and communicated all the information we need to communicate to parents so that they can make the best decision for themselves and their family. So we did a study where we recruited parents from UW and Children's Hospital. We interviewed about 56 parents who were hesitant about fluoride. We conducted interviews that lasted anywhere from a half an hour, and some parents talked to us for a couple of hours. And we use standard qualitative methods to code the data into domains to identify really what are the reasons, what is driving parents to say no to fluoride. And we put together a core construct. So really, there were five main boxes here, and these were the five main reasons why it is parents were saying no to fluoride. And what this rectangle at the top represents is the core construct. What is it that binds all of these reasons together? And it was really interesting because at the time that we were putting this model together was when our first child was born, and it's really interesting because this is a time where where we were taking our daughter in for well child visits. There were a lot of immunizations happening, lots of healthcare services happening. I was sleep deprived. We were trying to figure out how to become parents. So lots of stuff happening. And I think it was really, it was just really timely for us to be analyzing these data at that time in my life, because this core construct, which really ties together, again, the reasons why it is parents are hesitant about fluoride, is the desire to protect their children and to not mess them up. And again, like I said, I think that just this resonated with me so clearly. I think sometimes it's easy to dismiss fluoride refusal behaviors as being fringy, as parents who are uncaring or who are susceptible to conspiracy theories and whatever. The list goes on and on. And it's really easy, I think, to view fluoride hesitancy and refusal as a negative behavior. But for me, I remind myself again, what is it that we as parents do? We want to protect our children and we don't want to mess them up. And I think that remembering this, coming back to this, really is a good reminder of how it is that parents are making decisions, like decisions about fluoride. So we'll go over each of these boxes as reasons, and I'll also go over, based on our more recent data, how common each of these boxes are, because they're not all evenly distributed in terms of prevalence. So the single most common reason why it is parents will come in and say no to fluoride is thinking that fluoride isn't necessary. So 81% of fluoride hesitant parents, the reason why they're hesitant is that they don't think fluoride is necessary for their child. Here are a couple quotes. If you're not seeing tooth decay, then I think that's enough to know I don't need it. So this is a parent saying, look, I bring my kid in every 6 months. He's never had a cavity. I've never seen a cavity in his mouth. So I don't think the fluoride is needed. Second quote here, my children do still get cavities, even though they get fluoride twice a year when they go to the dentist. And so, again, this is really interesting because there's this concept of reverse causality, what we call reverse causality. Is there something about the fluoride that might be causing the cavities? And so concerns about that. We did a lot of dietary change when my son got cavities. It seemed to really work. So I guess it influenced me into not wanting to use fluoride. And this is the issue of I think, alternative ways to reduce your risk for cavities, which we'll talk about. And diet is really the single most important driver of all the disease that we're seeing in terms of cavities in the U.S. And particularly sugar in the diet. So we can talk a little bit more about that, at the end. So the second most common reason is parents wanting to keep chemicals out of their child's bodies. Now, we went into this. This was about 31% of the parents who were hesitant about fluoride were hesitant for this reason. Now, we dived into this really deep. We had really deep philosophical conversations with parents about how it is they were defining chemicals. And it's interesting, what parents were saying was that, chemicals weren't necessarily bad. So we're not in the bad, fluoride is bad territory yet. It's that they want to keep chemicals out of the child's body. So I'm just often weary of doing things with chemicals like that, like fluoride, that I know will be going into my children's bodies. I think that the human being should be more natural and not have too much outside intervention. And I just don't think it's good that it's absorbed into the mouth and gets into the bloodstream. So here we're not talking about fluoride being linked to, all these diseases and conditions and low IQ. None of that. This is just saying, look, if I can prevent putting something foreign into my child's body, I'd like to prevent that, which makes total sense. Again, that makes complete sense to me. Very reasonable. Okay, so this is where we start getting into, I think, with the third domain, where fluoride, thinking that fluoride is harmful. So thinking fluoride is causing some kind of condition or disease. And this was only 1 in 5 parents who were hesitant. So fluoride is unhealthy. It causes cancer and an array of horribleness. I still feel really strongly that topical fluoride is not a healthy option. And fluoride might be good for your teeth, but it can harm your body in other ways, which is really interesting here. So recognizing that, yeah, you know what, fluoride might prevent cavities, but it might be doing some other bad things to other parts of your body. The fourth category is feeling like there is too much uncertainty. So this gets at probably part of this is the information environment that we as parents are operating in. So whenever our kids get sick, we go online and we get a lot of information online, and some of it may be conflicting. So one parent talked to us about a lot of doctors actually are recommending not to get it. I found just as much information that was against fluoride as I found stuff that was for it. And so it was like, well, who's to believe? And it's hard because you hear things about things that they give your children 1 decade, and then 2 decades later, they're like, oh, sorry, we messed this up. And we certainly have lots of examples of this. And so given that there's uncertainty, given that, I go online and there are websites that say fluoride is important, but there are, also websites out there that say it's poisonous. I'm just going to go with the more conservative decision, just to eliminate fluoride exposure. The fifth category is feeling pressured to get topical fluoride. So this was 1 in 4 parents. So this kind of is a reason, I think, as a dentist, where I become a little more introspective in terms of how is it that I'm influencing parents in the way that I'm talking about fluoride. So why are dentists changing the verbiage to vitamins when it was fluoride not too long ago? It must be that more people are not wanting to do it, fluoride. The dentists are touting about how great it is, but it's just something extra for them to charge for. And he, the dentist, refused to give my child even a tooth cleaning unless I agreed to topical fluoride. So again, this is, I think, related to parent perceptions about what's in it for the dentist. Are dentists just saying, get the fluoride because they're going to be making money, because it's what they learned in dental school? And I'm a UW School of Dentistry graduate. Is it just something that dental schools indoctrinate their students to believe, and this is just something that they've learned and that they're just passing along to parents? And then so again, this idea that dentists are not these impartial, unbiased sources of information. So this is our model. So that really, I mean, with all these interviews we did, really it boils down to these 5 reasons with this core construct. Again, that's very reasonable, very, very reasonable. Okay, so what information do you need to make fluoride? So we've done some other studies looking at fluoride hesitant parents, and so we know that most parents who are hesitant about fluoride, they acknowledge that tooth decay is a serious disease, but they do not think their child is susceptible. So in the olden days, we heard a lot about parents saying, "Oh, you know what? They're only baby teeth, so baby teeth, we don't need to prevent decay in baby teeth, they end up falling out anyway." Or in permanent teeth, you know what? Cavities aren't a big deal. You just go get a filling. Very little of that. Actually, parents do acknowledge that tooth decay is a serious disease. Again, they just don't think that their child is susceptible. There are concerns about safety, with consequences of fluoride outweighing benefits. So again, recognizing that fluoride is beneficial, but that there are some either potential or real consequences associated with fluoride. And then they understand the benefits, but they prefer other ways to prevent decay. And this is where we get into that second risk factor in terms of sugar intake and diet. So I want to, underscore, in terms of the best available evidence that we have at this time. This may change in the future. This may change tomorrow. It may change next week. But based on my understanding of all the evidence out there, we know that all three sources of fluoride are safe. Water fluoridation at the levels that we have here in the U.S., safe. Toothpaste, safe. Fluoride varnish, safe. Or topical fluoride, safe under supervision. No form of fluoride should be administered just willy-nilly without supervision. So when it's water fluoridation, we have to have oversight. Water fluoridation isn't just this benign thing that anyone can go and supervise. It needs to be done by someone with training on how to do water fluoridation properly. When it comes to toothpaste, young children in particular need to be supervised. And what that means is that the parent needs to hold on to that tube of toothpaste and make sure that only a small amount is applied to the bristles. And then that toothpaste needs to be put out of reach. And this is something that we do here at home, particularly with our 15-month-old who loves to have his teeth brushed, which is really amazing and goes against most things that I see in clinic, but he loves the taste of toothpaste. And so I could see him, our younger child in particular, grabbing that tube of toothpaste and eating it because it tastes so good. And then the fluoride varnish that's applied during dental visits. This is done under the supervision of a healthcare provider. And then all three sources of fluoride prevent cavities. So we have strong evidence that all three sources of fluoride are effective. So necessity. So we think back to that model of what it is that's driving fluoride hesitancy, of why it is parents think fluoride isn't for them or their child, and it really was necessity. So my child doesn't need it. So really, necessity. This idea of necessity is based on risk. So what that means is there really are three main factors that go into whether you're at high risk for cavities or whether you're low risk for cavities. Now, one of the factors, and I know this probably is totally logical and it makes sense, is your history of cavities. If you've never had a cavity, if your child has never had a cavity, and your dentist says, well, I don't see any concern areas, there are no white spot lesions or watch areas, or things look fine, the grooves on your teeth look nice and shallow. If you've never had cavities, you're most likely low risk. And so that might lead you to make certain decisions about fluoride. The second factor is sugar intake. And sugar is everywhere. It's absolutely just mind-blowing, the types of foods that have sugar in large amounts of it. And so sugar, we're surrounded, in a sugar-laden milieu. And so sugar intake is probably the single most important behavioral risk factor that we would look at to see if we're at high risk or low risk, particularly beverages. So juice of any kind, sodas of any kind, and then the artificial juices like Tang and Kool-Aid. Those all are major sources of sugar. And then fluoride exposure. Again, thinking about what type of exposure to fluoride you have. So do you have exposure to fluoride in your water? Is your toothpaste that you're using, does that have fluoride in it? And then do you get fluoride from the dentist? So in terms of cavity prevention, really, it's these two things in terms of things that we have immediate control over, how much fluoride we're exposed to, and then our diet. So we have those three sources of fluoride. We have the topical fluoride from the dentist, toothpaste, and water. What we found was that fluoride hesitant parents, they're not always hesitant about all forms of fluoride. So parents who are hesitant about topical fluoride provided by the dentist, they're 4 times more okay with fluoridated toothpaste for their kids than fluoridated water. And a lot of this has to do with the ingestion factor, the fact that fluoride toothpaste, a kid can brush and then spit, whereas water fluoride is, or fluoridated water is ingested and consumed. So this is really where, again, fluoride, we can make nuanced decisions about the type of fluoride we want access to. And this is, again, both an individual level decision and a community level decision, depending on the type of fluoride. The second kind of bucket here, in addition to fluoride, is diet. And I would say, this is the single most important thing. As much as, I think fluoride is important because it prevents disease and it's effective and it's safe, diet is super critical. If we had no sugars in our diet, we probably wouldn't need most of the fluoride that we have. And parents we talk to prefer in many cases to reduce the amount of sugar their child is exposed to rather than using fluoride. Now the problem with this, and again, I think before children, I would have said, okay, well that makes sense. The problem with this is that you have kids who have preferences and desires, and I tell you what, as much as we delayed our older daughter's exposure to sugar, we talk about sugar probably at least a dozen times a day. She wants dessert every night. It's the first thing she wants when she wakes up. She wants something sweet. When we're on vacation, she wants sugar. And this aligns with the fact that there are very few evidence-based strategies out there to help families cut the amount of sugar their kids eat. We just don't have good strategies to do that. And so our group, in addition to studying fluoride, we're trying to understand ways that we can help families cut the amount of sugar in their kids' diet, particularly beverages. And so if you're interested, you can go online. We've done some work up in Alaska with Alaska Native families in terms of trying to cut down on sugary beverage intake like Tang and Kool-Aid. And it's tough. It's really tough because kids, they like what they like, and if they've been exposed to sugar, most kids love it. And so, as a parent, a lot of times, we have limited bandwidth, and a lot of times parents, and I include myself in this, is that we just give in. It's easier just to give your kids sugar than to fight it, a dozen times a day. So in terms of optimizing oral health, really the way that I view the different sources of fluoride, it's analogous to the way that we would maintain, for instance, a healthy heart. And in terms of exercise. So, generally speaking, you want to have a healthy heart. You want to make sure you're walking lots. Every now and then you want to jog. And then maybe occasionally you'll go out for a run. So this is generally, again, as a non-cardiologist, how I would view exercise as a way of maintaining heart health. Similarly, I think fluoride operates in a similar way, where the amount of fluoride that you get in tap water that's fluoridated is similar to walking. It's just very, very small amounts of fluoride that you get throughout the day that help to protect you from all those sugars that are in your coffee and in your meals and in the snacks that you consume. Now, the fluoridated toothpaste, this is once or twice a day, and so if you're supervising a child who's toothbrushing, you are making sure that you are controlling how much they're brushing with, and that they're spitting and rinsing afterwards. 1 to 2 times a day of fluoridated toothpaste, that's similar to jogging. So that's that, higher level of fluoride. And then the fluoride varnish really is the running. So fluoride varnish is safe 4 to 6 times per year. Some kids, do get it, every 2 months from their dentist if they're really high risk. And so fluoride varnish is really kind of akin to running. So this is really where, depending on what your risk is, what your child's risk is, you can really kind of control the amount of fluoride that you consume. And so again, I think these are all personal decisions, again, as well as community decisions, particularly when it comes to water fluoridation. And I just want to repeat with the water fluoridation again why it's so important. While personal autonomy is important, there are so many individuals and families out there who can't afford fluoride toothpaste, who don't get to the dentist because of their insurance or other barriers to care. So for a lot of kids and families out there, fluoride toothpaste and fluoride varnish they don't have access to it. So the only form of regular fluoride they would get is through tap water. And so I think that's really important to keep in mind when it comes to one's view on water fluoridation. And if you have the means, or even if you don't have the means, there are ways where you can pull fluoride out of the water. You can use filters, both on your tap as well as water filters. And if you Google those are all available online. So there is a way that you can remove fluoride from your tap water if you're concerned without um, uh, keeping it from other families that might need it. With that, I think we have about 15 minutes for Q&A. I want to acknowledge this really long list of collaborators. I mean, this has really been a community effort to really understand all the different things I presented on today about fluoride. And again, I want to thank my co-investigators and collaborators and the NIH for supporting this work. Thank you so much. With that, I'll stop sharing and we'll open it up for conversation.
Thank you so much, Donald. So much information. I see that I think Miranda had their hand up if they wanted to ask their question. Let's see here. Oh, never mind. Um, okay, there were a few questions that came through, and I think you may have addressed a couple, but it would be okay to kind of re-clarify on a couple of these questions here, Donald. Um, Specifically, first one being, so I guess the difference or between in that maybe in that last infographic kind of clarified it a lot, but why do we need fluoride trays if we have fluoride in their water and toothpaste? Um, and I think uh, equitability was kind of part of it, but also
Yeah, you mean why do we need the professional fluoride?
correct.
Yeah. So and I think this is where I think as a patient, as a parent, you probably have the most flexibility based on your child's risk. If your child has never had a cavity, is on, publicly fluoridated, water, and they're brushing twice a day, their added sugar intake is relatively low. This is where, as a parent, I would talk to the dentist and say, what's my child's risk? And I think that it's as simple as that. Is my child at risk for cavities, high risk or low risk? And oftentimes dentists will use algorithms to classify children into either two or three buckets, either high risk or low risk, or high, medium, low risk. And so that's something that again, that as dentists we're taught to do. And if a dentist says, well, your child's at low risk, then the next follow-up question is, well, if my child's at low risk, does my child need the topical fluoride? And I think these are, what I really want to emphasize is that these are opportunities for conversations. And again, I know that we all have limited time. We have limited bandwidth. Sometimes it's just easier just to go into a provider, a dentist office and just say, you know what, this is what I'm okay with. This is what I'm not okay with, and not have it be a conversation. And we're all human beings. We can talk through some of these things. And I think these are very reasonable questions that as a parent, I think is reasonable. So is my child, high risk or low risk? And if the dentist says low risk, does my child really need the fluoride that that you're offering right now? And then the follow-up question to that is why? So my child's low risk, you're offering the fluoride and you still think it's important. Well, why? And I would want to know that. That's a perfectly reasonable question. And I think that based on that conversation, then, based on this idea of shared decision making, you and the dentist can work together on making that decision. And I think the whys are always important. Why is it that you're recommending this treatment? And I don't get offended when a parent comes in and asks me why. I want them to. I mean, that's part of my job, is to explain why.
Yeah. Uh, Thank you. I do feel like, yeah, asking more and learning and understanding each child is different, their needs are different. So, uh, it used to be, I think, they would just offer it and people would just say yes, but asking those questions are very important. Um, and I think you may have answered this question as well, or just now, but I guess the question: do water filters like a Brita or custom pure remove fluoride from water? I'm sure like reverse osmosis water filters and other ones and the like can do that.
Yep, there are lots of commercially available water filters that will filter fluoride out of the water. You just have to kind of look at, and again, I know that even Brita, there are different types of Brita filters out there, so it's hard to categorically say. But yeah, I would read the box, and if a filter removes fluoride, it's pretty clear that it says it removes fluoride, and so I think that's a really important thing to know. And actually, a lot of families don't know, so you may actually be okay with the fluoride and you're filtering your water and you're losing that benefit of the fluoride from your water because you're filtering it out. So yeah, good to read the box before purchasing filters.
Yeah, so definitely check. Let's see. Next question here was can you kind of talk about the differences between fluoride containing rinses versus toothpastes? I'm guessing maybe concentrations of fluoride, maybe.
Yeah, and this is where yeah, and rinses typically are lower concentration fluoride, and so yeah, so I think again you want to read the labels. The way that we do this is that rinses really are aimed at use for either children or adults who can spit. So again, what you don't want to do is give rinse to a child and then have them swallow it just because again I'm less concerned about toxicity in terms of poisoning, but the concern about fluorosis is there. So if you have a child who is chronically swallowing fluoridated mouth rinse, even small amounts, you increase that child's risk of having fluorosis. And so yeah, so we can prevent that by just not giving young kids who can't spit yet, uh, by not giving them fluoride rinse. That being said, we live on Vashon, so we don't have fluoridated water here. So we do use fluoridated toothpaste, and we always follow up with our 6-year-old with a rinse. And we started that probably about a year and a half ago when we were confident that she could actually spit that rinse out.
Understood. Thank you. Looks like another question here. Uh, I guess is there a simple response we can provide to family and friends who are convinced that fluoride is harmful?
Gosh, I, that's a really good question. And I think particularly in this environment, we know that, Robert F. Kennedy, who is the U.S. The Department of Health and Services Secretary, even before he was nominated, there was a tweet about the federal government pulling fluoride out of the water. I think that these types of comments are really harmful only because it just shuts down conversations. So I think that, what I guess my recommendation would be is to keep those conversation lines open. And I think that goes back to what I was saying about, how it is that you address concerns about fluoride with your dentist. And rather than um, going in and just kind of cutting conversations off and saying, I'm going to do this and not do this. Let it be a conversation, and I think that applies to family members, and that can be conversations about a whole bunch of things, not just fluoride and vaccines, but other things that affect families. And we know that these days, families, within families, there are a lot of differences we have in terms of the way that we think about things, the way that we feel about things. And I think cutting conversations off or stopping communication is I don't think that's a good thing. So I think leaving the communication lines open, that's really important. And also understanding why. And not why in an annoying kind of argumentative way, but trying to understand where someone is coming from. And I think that that's really important. So when you go back to kind of the model that we put together of just wanting what's best for your child and your family and not wanting to mess them up, that's a perfectly great reason for not wanting fluoride. And again, if your child is at low risk and has never had a cavity, they probably can go without fluoride. That's okay. The concern as a clinician, and I think this is where maybe it can get a bit heated, is that you have a parent who doesn't want any kind of fluoride, but the child does have lots of cavities and is consuming a lot of sugar. What do you do there? And as a dentist, we want to help, and we want to help. And sometimes I think health professionals, and this isn't just dentists, I think health professionals, we get frustrated. We're like, okay, well, we really want to do something for you here. work with us. And so again, the answer isn't to get frustrated. I think it really is to leave the communication lines open, so that we can find some common ground and find some strategies that work. But I think that that clinically is probably the hardest position as a clinician to be in, is again a family who doesn't want fluoride, and the child has lots of cavities, and there's no change in the diet. The end result is your kid's just going to keep getting more cavities. I mean, that's just, and then they have to get them filled, or they might have to go to the hospital to get them filled. There are consequences there too. So I think that that's the other thing to keep in mind. And going back to that model of not wanting to harm your children, putting your kids to sleep for dental work, that is not without risk as well. So again, everything has risk, everything has consequences, and I think that's really important to keep in mind.
Yeah. Uh, I love that answer. I just think, understanding why and having that, keeping that conversation open before just unilaterally deciding, like, no, either way, in either direction is not going to be great for anybody.
Absolutely,
Yeah.
absolutely.
I think we have a couple more questions here. I think that we might be able to get to, but it looks like one question we had is, other than preventing cavities, are there any other benefits to using fluoride, like say reducing gingivitis? And also, thank you so much for an informative class, as what they wrote there.
You bet. Nope, not that I know of. Nope, fluoride is purely for the teeth. It's purely to remineralize enamel, and enamel is the outer surface of your teeth. It's the yeah. So it's other than that, not that I'm aware of.
Understood. Let's see here. I think we had a comment from Aubrey here. My dentist mentioned that the pH balance in your mouth is important. Drink water in between meals to rinse away residue, which helps to keep a balance of microorganisms and protect your teeth. Great tip.
Yeah, that's exactly, yep, that is exactly the microbiology of what happens and the physiology of what happens. Every time we consume, and the reason for that is every time we consume sugar, is that the bacteria in our mouth will metabolize that sugar, and the byproducts of that bacteria are acids. And that's what makes our mouths acidic. And that's what, over time, if you get enough of those acids from the bacteria, that's what causes cavitations or cavities in your teeth. And so anything to neutralize that, and water is a great thing to do. Will help in terms of preventing cavities.
Understood. I have a question for you as well, Donald. This one's might be a little bit out of the scope of fluoride, but I wanted to ask specifically. I've been seeing a lot of, I think, news and like just people popularizing this, I guess, chemical, I guess, called hydroxyapatite. I don't think it's as commonplace in the U.S. right now, but I do notice. I think the American Dental Association started to add that into their codes. But when do you think that we can start to see like hydroxyapatite being used more commonly in the US?
Yeah, there is actually there are a lot of social media sites, that kind of talk about hydroxyapatite. As of right now, I think the evidence is limited. This isn't
Mm,
to say again that there aren't trials or clinical trials being done that might show hydroxyapatite to be either as good as fluoride or better. But as of right now, the evidence isn't there. So in our home, we are not using hydroxyapatite toothpaste, and
yeah.
this is all based on the evidence.
Yeah, it's certainly, yeah, it's all over social media. People are like, this is gonna fix your teeth. And I'm just like, is it really? Like,
Yeah, based on the evidence, I don't know about that. Yeah, and I think there actually are also a lot of dentists that are out there. I think talking about hydroxyapatite toothpaste, partly because there really are no alternatives. I mean, to fluoride toothpaste, we have no alternatives, and so families want alternatives. And I think sometimes dentists maybe get cornered into providing some kind of alternative, which again, I mean, I want, if I'm going to recommend something, if you're going to go and spend money on something, I want to make sure that what I'm recommending has good, solid scientific evidence behind it. Other than that, you're lining the pockets of someone who probably knows better.
yeah. Thank you so much. And I believe fortunately, I think that's all the time we have today for questions. But I wanted to thank you again, Donald, for taking the time to share with us all the research you've done around fluoride and answering all of our questions today.
You bet. Happy to be here, Sebastian, and thank you everyone for joining us.
Yes. Thank you. I hope everybody also has a good rest of their day as well. Take care, everybody.